He's Dr. Chris.
He's Dr. Xand.
And we're
Identical twins.
Or we were until you grew your beard.
In this series, we've taken over one of the biggest children's hospitals in Europe, the amazing Alderhay in Liverpool.
We've been going head-to-head, taking on the hospital's most important jobs.
This isn't going well.
Ouch and About has been hitting the wards for more medical mysteries.
That is a hole going inside your stomach.
Yes.
And we've been meeting our brilliant ouch patients who come in for regular treatment.
Hello.
We've hidden our lab in a top-secret location.
And our experiments just got bigger!
You guys are crazy.
So get ready to join us. It's going to be out of this world!
What are you doing? Coming up today on
Operation Ouch!
We mess up in the kitchen.
Oh, shouldn't have done that.
we push it in the lab.
Oh! And I show April something yucky.
What were you expecting?
But first...
Medical teams are trained to expect the unexpected.
Boo!
Told you so.
OK, now try me.
Boo. Waiting in Alderhay's emergency department with her mum is 14-year-old Charlotte.
I was doing a tap dance.
Uh-huh.
We do loads of lifts and stuff.
Go on.
And just ended up falling.
Ooh, that doesn't sound good.
All I've been doing all day is like out, 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 like that all day.
OK, how did it happen?
Charlotte was at school in dance.
Ooh, I love a good prance.
She went to do a dance move.
She's getting into her groove.
When she did a handstand...
Where did she land?
This is the worst rhyme ever, Xand. Anyway, it didn't go right.
Oh no, what a fright!
She fell on her head on the floor.
That sounds very sore. Ouch!
But I'm supposed to do a dance tonight, but I don't think I'll be able to do it.
Oh no!
Tapping his way to save the day is Dr. Johnny Wong.
Have a little examination of your neck, is that all right?
Yeah.
Okay. So I had a little feel down her spine to make sure there was no pain when I was touching with my finger.
That hurts.
Just a bit sore, is it?
Yeah.
I was make sure that her neck movement was okay, so she was a bit stiff.
That really hurts.
The worst case scenario is she could have injured the nerves going from the back of the head down her spine, which will give this tingling sensation in her neck.
Dr. Wong takes a look at some x-rays done earlier to check if anything's broken.
After some careful examination, he gives Charlotte the news.
You've got no broken bones, but what we're going to send for you is an MRI scan.
So, the x-ray is showing no bone damage, but to check there's no injury to Charlotte's brain or soft tissue, they're doing an MRI.
An MRI is a special kind of imaging scan.
It uses powerful magnetic fields to produce detailed pictures of the inside of your body.
MRI images of Charlotte's head will give the doctors vital information about her brain and the soft tissue around it to make sure everything is working properly.
I do feel like I'm in Holby City or something.
No, you're not. You're on Operation Ouch.
Yes, Charlotte, and it's time for your MRI scan.
There's definitely no dancing for this, Charlotte. To get sharp images, patients have to lie very still.
All finished, Charlotte heads back to the ward.
Ah! What's going on with that bonnet?
I needed to take my bubbles out.
Of course.
Now my hair is all messy and not as nice.
Well, we like it.
Find out later how Charlotte gets on with her MRI results. Did you know you're more likely to chew your food on the right side of your mouth if you're right-handed?
And on the left side if you're left-handed.
What side do you like to chew your food on?
And now to our lab. But this time we've hidden it in a top-secret location.
So secret that even Xand doesn't know where it is.
It's time for our last experiment of the series. Just don't try anything you see here at home.
Today we're finding out about a surprisingly strong muscle in your body.
Oh, 502. Wow, Xand, 502, that is really impressive.
Well, I've got to keep my muscles big and strong.
That is a good idea. Here, let me have a go.
No!
Xand.
Do you know what the strongest muscle in your body is?
Well, we're going to show you. Now, what we're going to need for this, Xand, is someone really, really strong. Have you got anyone in the cupboard?
Let me think. Oh, I've got the perfect person. Tiny! Sideways, Tiny. I've told you, sideways.
All right, Doc.
Oh, hi, Tiny. Now, you might remember Tiny from Series 1. He lifted me above his head.
Meet Tiny from Tottenham.
Yeah, we've already met.
Now, as you can see, Tiny has lots of big muscles all over his body. But which of his muscles do you think is the strongest?
The bicep?
It's a good guess, Xand. They're some of the biggest biceps in Britain, but they're not the strongest muscles in his body.
How about the gluteus maximus?
That is strong, but for its size, it's actually his jaw muscle, or to use its proper name, the masseter.
Your jaw has 4 main muscles that help it move up and down.
All 4 work together to move the jaw down, but it's just the mighty masseter that pulls it back up.
It allows your jaw to exert enough power to chew through super tough foods, and so for its small size, it's the strongest muscle in your body.
Now, you can feel your masseter at home if you touch the side of your face here like this and slowly clench and open your teeth. You should feel it popping out the side of your jaw. Can you feel it, Xand? Tiny? What are you up to?
I'm almost there. Well, that was closer than it looked. We'll have a rematch soon, Tiny. Thanks for coming in.
Well, I'll be off home then.
All right.
Thanks, Tiny. So, now we know what the strongest muscle is, but why don't we put it to the test to find out just how powerful it really is?
And for this, I need...
The bite force meter. Its job is to measure the power of force applied to it, so we can test the strength of my jaw. Xand, how strong do you think your jaw is?
Strong. Not as strong as my hands, but still strong.
OK, Xand, well, let's put that to the test.
It's time for Battle of the Bite Force.
Now, Xand, squeeze that as hard as you can between your hands. Squeeze!
The force is being measured in pressure, equivalent to kilograms applied to the sensor.
3.8, 4.2, 4.7.
Must be some kind of world record, I would think.
Well, let's see. Now I'm going to put it in my mouth and you can read off the number.
Don't you try this dangerous scientific experiment. We can because we're doctors.
Bite! 28, 30.5. That is amazing!
Wow! Chris's jaw is 6 times stronger than my entire upper body.
And in fact, Xand, my jaw's even stronger than that. If my teeth were made of steel and wouldn't break, I could squeeze up to 55 kilos.
To demonstrate how strong your jaw is, we're going to show you what its strength could do to everyday objects.
So we're going to need these: a can of pop, a glass, and a mobile phone.
Ooh, that looks just like my mobile phone.
But we can't test the strength of our jaws using our teeth, so for this, we're going to need a special machine. This is a hydraulic industrial crushing machine. We're going to use it to crush things with a force of 55 kilos, the strength of a human jaw.
So let's start with Xand's, a mobile phone. I'm pumping the machine up to 55 kilograms of pressure.
It's not looking good for that phone.
2 metal prongs are crushing the mobile phone.
There you go, a phone crushed with 55 kilos.
Now for a can of fizzy pop.
It's squeezing.
The pressure's rising. Come on, Bitey, you can do it. Ah! And that's why I never bite my fizzy drinks. That was amazing.
So we've seen what our jaw strength can do to a mobile phone and a metal can. Now let's try a glass.
Here we go.
Chris gets the machine up to 55 kilograms of pressure again.
Oh!
There we go. A force of 55 kilos applied to a glass. All I can say is very lucky we were wearing the safety equipment.
So we've shown you that the strongest muscle in your body for its size is the masseter muscle, which squeezes your jaw closed.
In fact, your masseter is so strong that under laboratory conditions, we've been able to show you what it would be capable of.
But obviously this would be a stupid thing to do with your mouth, as you'd break all your teeth.
That was so amazing. I'm going to phone Mum and tell her about it. And where's my mobile phone?
Now I'm hitting the wards with my Ouch bleeper, because we've brought Ouch and About inside the hospital.
Wow.
Doctor's on!
Oh, and I'm hitting the streets to answer your medical mysteries. In the hospital, Chris is in a right pickle.
Oh, a question.
Someone's hungry for answers. It's from Ben, who's had a leg operation.
Hi, Ben. How are you?
Fine.
What's your question?
Why did he put orange stuff on your leg before an operation?
What's the diagnosis, Doc?
Sounds like a case of why do they put orange stuff on your leg before an operation? It's a sterilising paint, so it kills all the bacteria on your skin, and that means when they do the operation, no bacteria get in your body to cause infections. But the reason it's orange is because that tells the surgical team where has been cleaned and where hasn't. So if you're doing an operation and suddenly you notice there's a bit of skin that isn't orange, you know that bit of skin is dirty and it needs to be sterilised. Does that answer your question?
Yes.
There you go, Ben. Have a sticker.
Thank you.
I'll see you soon.
Bye.
I'm out and about on the street, and there's someone waiting to see me. It's Rodas, who has an allergy to nuts.
How does EpiPen help you when you have a nut allergy?
Well, nut allergies are very common. They're one of the most common allergies there are, and they can be very severe. Basically, your immune system recognises the nut as something bad, and you get swelling all over your body. The swelling is very dangerous if it's happening in your mouth or in your throat, because it stops you breathing. Now, the EpiPen is full of a hormone called adrenaline. When you inject it, it will tighten up your blood vessels and decrease the swelling and allow you to breathe again. So if you're carrying an EpiPen, you are safe, which is really important. Keep your EpiPen with you, all right?
Back on the ward, the bleeper's bleeping.
It's a question from Jamie Lee, who's just had a chest X-ray.
So what's your question?
Why are burns white on an X-ray?
What's the diagnosis, Doc?
Sounds like a case of I want to know why bones are white on an X-ray-itis.
Make it snappy, Chris.
I'm going to try and answer that. But first I need to explain how X-rays worked in the past. We'd put a piece of film behind Jamie's chest, and the piece of film is white. And then we'd shine X-rays, which is like very powerful light, through your chest. The X-rays would pass through soft tissue, like your lungs, and hit the film, turning it black. But your bones, because your bones are made of hard stuff, a bit like rock, the bones absorb the X-rays, which stops them from reaching the film, so it stays white. The truth is now, we take X-rays using digital film, so we could actually colour them how we wanted, but doctors got used to seeing them the old way in black and white, so that's the way we've left it. Does that answer your question?
Yes.
Good. I think you have earned yourself an Operation Ouch sticker. You want to stick it on your chest? Thank you, Jamie. That was an excellent question.
Thank you, Dr. Chris.
That's a pleasure. Bye.
Bye.
Job done for today. Clinic closed.
Chris, I wonder how our patient's getting on in the accident and emergency department.
We don't have to wonder, Xand. We could just find out.
Charlotte came to the Alderhay emergency department with a bashed bonce.
Charlotte was in dance class when she did a handstand.
It went wrong. She fell and landed on her head.
Earlier, X-rays showed there were no broken bones, but she had to have an MRI scan to check nothing more serious had happened to that knocked head.
Dr. Johnny takes a look at the results.
I can't see any swelling or anything that would suggest there's any broken bones that we saw on the X-ray as well, which is good. So with the X-ray and the MRI scan, we now know that there's no nerve issues, there's no broken bones. We can clearly say that there's most likely to be a muscle injury, which is why she can't move her neck as well. She will get better in probably a week or two time with rest and some good ice on the actual neck itself.
Good news! But what does it mean for Charlotte?
Just needs to do exercises 10 every hour.
That's a lot.
So it doesn't go stiff and sore again. But I can't dance or do anything for 2 weeks.
What will you do?
I'll just have to do singing instead of dancing for a while.
Good plan. Bye!
Still to come.
It's our treats for the ward.
These are going to be the best biscuits ever.
Bogey cleaning.
The most thorough nose picking you could ever have, right?
Yes, that's right.
And strange things are afoot in the emergency department.
Dogs eating soup.
In hospital, it's not just the doctors and nurses who help to get you fixed.
There are lots of other heroes working behind the scenes.
Ah, yes! What will happen when we have a go at their amazing jobs? Welcome to the Dr. Chris Show.
Useless.
This is Operation Takeover.
Today's takeover hero is ward chef Damien. Every ward has its own chef, and he's one of the incredible team cooking all the healthy, tasty meals in the hospital that help patients to get better.
This idea is all about making sure we serve the kids food as a part of the medicine, and then making sure the kids eat breakfast, dinner and lunch.
Damien is spot on. Eating well and enjoying your food can really help people to get well quicker. So on the wards, it's the children who choose what they eat from a healthy menu.
Bon appetit.
Bon appetit, Ruby.
So, what do the patients think of the ward chef's food?
How has the food been?
Nice.
Has it been really nice?
Yeah.
Do you feel like you're getting well fed in the hospital?
Sure.
And what do you think you're going to have for dinner?
Sausages and mash.
Do you think they're cooking it right now?
No sausages for you, Xand.
Oh, Chris.
So we found out just how important the ward chef is to the running of a hospital.
But have we got what it takes to step up to the plate? Get it? Plate?
The chefs make treats every afternoon to cheer up their patients, and today that job is falling to us.
It's time for us to take over as hospital ward chefs.
You're going to make cookies.
Cookies? Yum!
Yes, Xand, we've both got identical ingredients and decorations to make our cookies. They'll be judged on how good they are by Damien, and then Jacob and Dominique.
But before we start, we need some advice from someone who knows all about cookie making. Tilly Ramsey.
Hello, Dr. Chris and Dr. Xand.
Hi, Tilly.
Number 1, don't rush. And number 2, make sure all your ingredients are ready and laid out before you start. But most of all, have fun.
Thanks, Tilly. Bye.
Your time starts now.
Let's get cracking.
Just need the egg yolk.
I'm just doing this quite roughly. I'm not overly concerned with getting everything right to the nearest gram.
Winging it, eh, Chris? I'm going for a more measured approach.
Fingers, Xand.
Shouldn't have done that.
I may be in trouble here.
It's just sin in licking your fingers, which is not a good practice.
Is that illegal?
Oh,
Better wash my hands again.
I've got some nice blue food colour.
I'll just have to make my own green by mixing yellow and blue. Perfect.
Oh no, Xand's using his hands again.
So are you, Chris.
Luckily, we've both washed them.
I am going to make one big biscuit.
My attention to detail will win in the end.
These are going to be the best biscuits ever.
So there is my blue C, ready to go in the oven.
Tilly would be proud. In they go.
And out they come.
And now for a few finishing touches.
It'll take more than that, Chris, to beat me.
Oh, I ran out of icing. And now it says Dr. Crick.
Ha! Well, now I've definitely won with these beautiful... Ah! They're burnt!
Oh, dear.
Well, that's nothing a bit more decoration won't fix.
Et voila. Time to see what Chef Damien thinks.
looks burnt, and oh, it's even raw inside.
Ha! Xand's is burnt and raw. I'm gonna win.
Sorry, Chef. What about mine?
Yours is still raw inside.
Ha ha! Raw as well. Touché, mate.
But the look of it is not safe to eat.
That's bad.
We have to judge them on appearance alone.
We certainly blew that one.
Yes, we did. Utterly failing in our task by making cookies the patients can't even eat.
Don't tell Tilly.
So, after our failure, the verdicts will be based on decoration alone, to be decided by the most important judges in the hospital.
Ta-da!
Wow, you decorated it. That's amazing.
Impressing already.
Right.
Yours is beautiful.
What? You think mine is beautiful? So, Jacob, you're not a sprinkles man.
Time for the result.
Which plate of biscuits do you think looks best? One for me, oh no, and two for Dr. Xand. His is burned.
So, we've seen that Damien and all the chefs here work really hard to make sure the patients get the right and most delicious food to make them well.
I think we should leave it to the experts. There you go, Damien.
Your body is amazing, but sometimes it needs fixing.
All over the UK, there are special teams of professionals trained to help tackle medical mysteries.
And today we're in the ear, nose and throat department, or ENT. And I know what you're thinking. You're thinking that department probably deals with people's arms and legs. Well, you're wrong. They deal with ears, noses and throats. The ENT doctors here have to treat a wide range of ear, nose and throat problems. These doctors specialise in all three because they're all connected, so problems in one can often affect the other. Now, ear, nose and throat surgery, you can imagine, might be kind of easy. You can get to the throat through your mouth, you can look up people's noses, you can get into their ears through the ear hole. But it's difficult doing surgery through a small hole, and that's what I'm going to show you.
First up in the ENT department today is Michael.
He has a recurring infection in his ear, so he's here to let the doctors have a look. Is there any bit you're nervous about?
No.
Well, that's good.
To look around Michael's ear today is surgeon Mr. Ian Street.
Mr. Street uses a special microscope that allows him to see deep into Michael's ear canal. He soon finds the problem. What you can see is a lump of rubbery pink tissue that's being produced probably because there's still a bit of infection there. So that needs to be removed so that all clears up.
If I can't get all of it out, it at least tells me there's still something grumbling on in the background there that needs to be dealt with again.
With the aid of biopsy forceps, Mr. Street removes a tiny piece of the problem tissue for further tests. So for now, Michael's all done.
Soon he's awake and back to his normal self. How's your ears feeling? Good job.
Next up is April. She's here to have her tonsils out.
Can we have a look? April's tonsils have to go because they've become enlarged and are making it difficult for her to breathe. This keeps her awake at night, and once they're out, she has a plan.
I really want to keep my tonsils.
Well, like in a jar. What are you going to do with them?
I wanted to show the class.
I'm sure that would be a popular lesson, April.
So, she's off to surgery.
First, Mr. Street has to snip them out using a special cutter. Without her tonsils, April will be able to breathe much better at night, which means she'll get a good sleep, and that will make a really big difference to her life.
And here they are. They're not only massive, they're also infected, which means that April won't be able to take them home after all. But I've got the next best thing. Do you want to see a photo of what happened?
So that is the first tonsil. What were you expecting?
From that reaction, I think she's happy not to keep them. Our next patient is Lola, and she has nose issues.
What is wrong with your nose?
Nosebleeds.
And how many nosebleeds have you had?
Millions of millions.
That's a lot. Here to check out Lola's bleeding nose is surgeon Miss Anne Markey.
She's looking up her nose with a special camera to find out where the bleeding's coming from. But she encounters a few obstacles along the way. And that's a bit of snot there, is it?
It is a bit of snot, so we'll suck that snot away.
This is like the most thorough nose picking you could ever have, right?
Yes, that's right.
With the nose clean, Surgeon Anne finds the source of the problem, a damaged blood vessel.
And you're pretty sure that's causing the trouble?
Yes, and I haven't seen anything else that's made me think there's bleeding coming from anywhere else.
Now the damaged blood vessel can be sealed or cauterized to stop it bleeding. Presumably she's just not allowed to pick her nose for quite a while.
Well, ideally, she won't ever pick her nose again, but I think that's optimistic for all of us, I think.
Nosebleeds can be serious, but in only about 10 minutes, Anne has taken Lola from having a big risk of nosebleeds to really not having any problem at all.
And that should make little Lola very happy indeed.
So now you can see that it wasn't just a random decision to call it the ear, nose and throat department. That's exactly what they do here. Ears, noses and throats. And they're really good at it.
Our next patient's day has taken an unexpected turn.
Like that?
Nose aren't. Luckily, they've ended up in the right place.
In accident and emergency with his mum and dad is 10-year-old Francis. What have you done, fella?
I've stood on something sharp and stabbed deep in.
That sounds nasty. Let's find out more.
Francis was at home playing with his brother and their Labrador Roxy.
Don't worry, I speak dog. Ruff, ruff.
Right, OK, anyway. His brother had a great idea to go and play footy outside, so Francis made a quick dash for his kit.
Hold on, Chris. Roxy's not sure about this. She says there's a...
Don't be silly, Xand. Football's brilliant.
No, Roxy's not happy. She says, stop!
What's on? What?
There's 10 kids wearing flares.
What?
Oh, no, sorry, wait. There's a tin lid on the stairs.
Too late. He stood on it and cut his foot.
Ouch!
Here to find out why there was a can on the stairs, amongst other things, is nurse practitioner Julia Maxted.
Can you tell me what happened?
I stood on a lid of a vegetable soup can.
Ooh, I love vegetable soup.
And so it was the actual lid bit that you stood on that cut your foot.
But where did this can come from?
Who left it there?
The dog.
The dog? The dog's eating soup.
So Roxy's a soup-eating dog? Now I've heard it all.
Nurse Julia takes off Francis's bandage.
Gross alert. Look away now if you want.
And gives the wound a clean so she can see what's going on.
Nurse Julia checks the feeling and movement to make sure he hasn't done any damage deeper in his foot.
It's actually really quite superficial. I'll close it with some steri strips just to help keep it clean and stop it from oozing.
Sounds like he's had a lucky escape. But what about the dog?
Hope it's going to be careful with the vegetable soup now.
Yeah, maybe just soup from a packet from now on.
With the wound all closed up, it's time for Francis to head home. And what's today's lesson been?
To make sure that I'm looking where I'm going. Because at the time I weren't paying attention whatsoever on what I was stepping on.
Good plan. Bye! In this series, we've loved taking over one of the biggest children's hospitals in Europe, Alderhay in Liverpool.
We've met incredible medical teams.
Now Will's job is to keep Kieran safe.
And the hospital heroes who keep a busy hospital running.
Even if we were rubbish at their amazing jobs. I've lost my shoe completely.
Useless.
Ouch and About hit the wards.
That's actually quite cool.
And the emergency department was packed with you and your medical mysteries.
I fell over and hit myself on the goalpost.
We've been privileged to follow the treatment of our very own Ouch patients.
Hello.
And it wouldn't be Operation Ouch without some show-stopping investigations.
Wow, that is amazing. And a few big bangs! To show you how incredible your body really is.
Back to Earth! So that's it till next time from Operation...
Ouch!
And take care of that brilliant body of yours.
Can I just say... 21.2? That's more than what was my number?